A few years ago, I decided to call it quits with who I thought was the love of my life after almost a decade of marriage. At the time I started dating him, I was 18. At this point, I was 32. At the time, I thought about all the time that I spent in my 20s focusing on being a mother and being a wife. All the rest of my friends were enjoying the college life. They were partying, traveling the world, having a good time. And I decided to put a bet on fulfilling the life that I thought that I wanted. I felt like I had taken a gamble and I lost. I felt humiliated by the fact that I didn't think about ending it sooner. I thought to myself, will anybody ever love me again? What's wrong with me? And why didn't I see the signs sooner? In that point, it really caused me to stop and think, maybe my happiness was important. Maybe doing all the things that I thought I was supposed to do, being a wife, being a mother, climbing the corporate ladder, checking off all these boxes before I was 30. Maybe that wasn't as important as I thought. And I decided to focus on myself. And I went to therapy. And as therapists do, she challenged me to connect with my inner child and find the things that made me happiest at the happiest point in my life when I was a child. And I thought to myself back when I was 5 years old, and I remembered my Jamaican grandmother. And she had every shoe in her closet that matched every color of her outfit. And in the daytime, she wore house dresses, she had her head wrapped, and she was just my grandma. But at nighttime when she had to go out, she would have her outfits dressed to the nines, her shoes were perfection, her accessories were perfection, her hair was done, her nails were done. She looked like a model fresh out of Jet magazine. And at that time, I said to myself, I want to be like her. I want to emulate that grace and that class and that elegance that I saw in her. And when she got dressed, she looked different to me. She walked different, she talked different, her demeanor was different. And I said, I want that. I want that transformation for myself. But when I got home and from that therapy session and I looked in my closet and I looked in the mirror, I didn't recognize myself. I didn't know who I was. I spent so much of my time trying to be what I thought my husband wanted, and I lost myself in the process. I spent so much time trying to be what everybody else wanted me to be, and I lost my sense of identity. So I did what I thought I wanted to do. I went back in time and dressed how I always wanted to when I was 18 years old, when I was in my 20s. The only problem is I didn't really know how to do that. At this point, I had crow's feet on my eyes. I had a mom bod. I had knees that couldn't drop it low on the dance floor anymore. I had smile lines. I have all these insecurities I didn't have when I was in my 20s. But I gave it a shot. And in this outfit, you'll see. I love that. So this is what we call an epic fail. This is my attempt to recapture my youthful days as what I wanted to wear when I was 18. And as we can all agree, this was a fail. And I had a series of failures like this where I was trying to find myself and find my style and find who I wanted to be, opposed to what I used to be. Back then, I used to dress like this, what I call nun-like attire, things that were very loose in the waist, long hemlines, high necklines, and they often could transition between places that I went the most, between work and church, and without causing much of a fuss. And I said to myself, this can't be right. This is not what I remember from what my grandmother showed me. So slowly but surely, I started to gain a little bit of confidence, and I started to find myself. And I had an idea, and I said, what if I wore something with a little bit of a higher hemline? What if I wore a lower neckline? What if I went crazy and added a pop of color and wore them both at the same time? And I found myself, and I found my identity, and I said, you know what, this feels right. This feels like me. This feels like a 30-something-year-old woman that's still confident and sexy and comfortable in her body. And then I went on a series of things, moments like this, where I slowly started to gain my confidence and find things that fit me. One of the things that I remembered in this time is when I went to college to pursue my degrees in marketing, there's something called color psychology. And color psychology basically tells you about different colors and the psychological impact that it has on a person's mind subconsciously. And the color white, for example, usually signifies healing, health, and hope. The color yellow is something that is associated with happiness and being jovial. The color green is something associated with growth. The color blue, trust. The color purple, royalty. The color red is a passion color. The color black is often associated with leadership and independence. So on some of my darkest days, I wore some of the brightest colors that got me to feel the way I wanted to feel from the outside in. I wore a lot of yellow, I wore a lot of green, and even a sprinkle of purple. And I slowly started to realize that my mood was changing from the outside in. And I captured a sense of myself that I felt that I had lost for sure. And I found it at this point in my life. Another thing I remembered at this time is when I worked at my aunt's nursing home when I was 14. And I use the word work loosely because I did not get paid. However, I did. And there was a resident that checked into my aunt's nursing home. And she was approximately 80-something years old. And her family was concerned about her health because she was losing a lot of weight and she was very frail. Now, although she could function independently, she could walk by herself, she could talk by herself, she could dress herself, her family was concerned about her state because she was very frail. And a few weeks into her check-in, my aunt, a registered nurse, took an approach that I'll never forget. She came from the store one day before dinner, and I was doing laundry as I did, and I went to the resident's room, the patient's room, to unpack the laundry, and I noticed a pack of thongs on her bed. And I said to myself, is this supposed to be here? So I went to my aunt and said, hey, there's a pack of thongs on her bed. And first of all, I was jealous because I wanted them for myself, but that's another story. My aunt said, yeah, there's no mistake, that's for her. And I'm like, okay. So as the kids say, I stood around for the plot. And I stood around to see what was gonna happen. After dinner, I would normally eat, go back to my room and watch my shows. And I didn't this time because I wanted to see what was gonna happen. And after dinner, like clockwork, the patient went into her room and came out with questions. And she's like, why is this here? My aunt's like, no, this is for you. And this woman was hysterical. She was laughing so hard. She thought it was the funniest joke she ever heard in her life because she's an 80-something-year-old woman. And she said, this is hilarious. I've never had this happen. So in any case, a few days later, the patient took my aunt up on it and she wore the thongs. And that morning she came out of her room, I knew it immediately. She was laughing. She was smiling. She was saying how sexy she felt. She hasn't felt this way in years. And the few weeks that passed after, the weeks following, she did improve. Her health did improve. Now, while I'm not a medical doctor and I can't make any medical claims, and of course this was probably coupled with other treatment and other therapies and other medication, I strongly feel that this had an impact on her that maybe medication alone may not have done. Now, scientifically, I did do some research with regard to some studies that I found, and it has been determined in a study from 2013 that cancer patients sometimes have worse psychological effects when they have physical symptoms of the cancer than even the diagnosis itself. Cancer patients who suffer from hair loss, disfigurement, and scarring often had lower levels of satisfaction, life satisfaction. They suffer from depression and anxiety. In a study from 2022, however, breast cancer patients that receive image care interventions often had higher levels of happiness, lower levels of depression, and lower levels of anxiety after the treatment was done. In that particular study, beauty specialists came in and they performed a few different things, teaching the patients beauty techniques as a form of coping. And at the end of the treatment or the end of the workshops with the beauty professionals, that's when the results were found that they were happier with themselves, lower levels of depression, and lower levels of anxiety. So this I say to you, Give something new a try. Try a new outfit. Try a new style. Try something that may make you change your mind about yourself. Wear it to the supermarket. Leave your house with it. Try something new and a new approach that you may not have considered, and you'll be surprised where it takes you. Hopefully you'll be able to find that it has the same effects of recovery as it has for me and others. Thank you.